Okay, good afternoon, everyone. Welcome to this webinar on International Human Rights Day, the impact of COVID-19 on human rights. We will be starting in 5 minutes. All of our panelists are here, whom you can see in front of you, and we look forward to a lively discussion. So before we start, you will see before you in the chat box a link to the Facebook, a Facebook link which you can kindly share through your own Facebook pages and networks. So let's start, please, with the event. You will see before you some webinar guidelines that we have adopted and that we follow to have a smooth event. So participants are muted upon entry. The video is permanently closed for this event, for this session. The Zoom queue, please use the Zoom Q&A function or the raise hand function if you have any questions throughout the webinar, throughout the session. And you will receive updates from the Asia Center in the chat box that you all, I'm sure, are aware of by now. So a few guidelines, I wish to say a little bit about the Asia Center, and we welcome Lorraine. Welcome, Lorraine, it's great to see you. Asia Center is a not-for-profit social enterprise which undertakes evidence-based research on regional human rights, democracy, and other regional issues. We undertake activities and events to engage on those issues, such as this webinar, such as seminars, such as engagements with parliamentarians and other policymakers on rights and democracy issues. And as you see there, we engage in media and advocacy, policy-oriented work aimed at improving the state of affairs in the region and beyond. So please go back. Thank you. So it is a not-for-profit social enterprise, and I just wish to emphasize that we are now accredited with the United Nations ECOSOC. We have achieved a special consultative status as we engage henceforth on these issues. So welcome. Welcome again, and I just wish to highlight our reports that we have recently published in the course of the past year on internet freedoms, on Myanmar, Timor-Leste, Cambodia. In the case of me, you see the reports there with you. Please scan the QR codes and please have a look at our website and kindly help us to disseminate and share these reports through your networks. I would like to also mention, since that we have many commissioners today from national human rights institutions with us, our own work on national human rights institutions in Southeast Asia. Following our international conference in 2017, we published also this book, and you may receive a link to this publication in our chat box very shortly. We have looked at Southeast Asian national human rights institutions from regional and global perspectives. We have looked at protection challenges in Southeast Asia and thematic perspectives on NHRIs in Southeast Asia. So we invite you to please have a look and also to please share this with your colleagues and networks. I would like to also note that we will have next week on the 15th of December, a webinar, a seminar to launch a report, a new work on business and human rights in Southeast Asia, progress towards developing national action plans. And that report is set to be launched, announced next week. So please look out for that and help us to share this activity as well within your networks. All right, and next year, finally, we have our seventh international conference on freedom of expression in Asia, and we welcome expressions for partnerships of interest, expressions of interest for partnerships. This will be from 24 to 26 of August of next year. There's the QR code, and also please share this with your networks, as we just said. So without further ado, it is now 2 o'clock, just after 2 o'clock. Let me call upon Mr. Friedrich Spohr, head of the Friedrich Naumann Foundation for Freedom in Thailand, and he will kindly make some opening remarks to this roundtable discussion this afternoon. Frederic, please.
Yeah, thank you very much. Robin, thanks a lot. Dear commissioners, dear audience, thank you very much for joining us today. Just this week, I heard something really, really depressing in the radio. UK scientists, advisor to the government, said that we might be closer to the start of the pandemic than to its end. So I think that clearly shows that the lessons and the conclusions that we will learn in this discussion, we will really need them not only in the next month, but they will be important maybe in the next years. I'm head of the Friedrich Naumann Foundation in Thailand and Myanmar, and my organization promotes democracy, free markets, and human rights in more than 60 countries. And of course, we see that COVID-19 is a test for all societies if they take human rights serious or not. We see measures and restrictions that are clearly unjustifiable, and they should mostly serve those who are in power. Censorship and criminalization of journalists, using of state of emergencies to stop political protests, or the use of hate speech to exclude and defame certain groups. But I would also like to say that nearly all measures that were taken globally to contain the pandemic have severe implications on human rights, even those who seem reasonable and seem legit. But we also have to be careful with them. And I'm a bit sorry to say this old proverb, but the road to hell is paved with good intentions. So just give you some few examples. Border closures, they of course restrict the freedom of movement. School closures restrict the freedom or could harm the right to education. The closure of museums and concert hall, they restrict or harm the right to participate in culture. Closure of bars, restaurants harm the right to leisure. So some restrictions, they are easily to be justified. Sometimes they are difficult to justify, and sometimes they are not justifiable at all. And sometimes restrictions are totally okay for some groups, but not for others. So let's say mask wearing, for example. For me, of course, it's not a human rights violation if I wear a mask, no problem at all with that. But what about people who are disabled, who cannot hear? For them, their life changes completely. And just to give you an example of one region in Germany, they specifically say that it's okay to put off your mask in a room if there are like people who cannot hear you in the room. So it also depends on how you implement the rules. There are also some measures that were completely unthinkable just a couple of weeks ago. Right now in Germany, we are discussing about mandatory vaccination, and that was something that, yeah, I would have never expected that this discussion would even happen in Germany. Now it seems that it will really come, maybe in February. And personally, I don't have a real clear stance on that yet. I'm not really sure if this is a good idea or not, because of course, it's a violation or it's an interference in the human right of bodily integrity. But on the other side, it helps to protect vulnerable people and could protect lives. So yeah, there are a lot of questions that I'm also not really sure how to evaluate them. And that's why I'm really happy that we have distinguished experts on that panel today. And I'm really looking forward to the discussion. And also thank you very much for Asia Center for organizing this. Thank you very much.
take note of the concerns and the depressing news that you got. So if you don't mind, for 5 seconds, I would like to bring a smile back to your faces. And if you could just smile for the camera for 1 second while we take a quick screenshot of you all. All right, 1, 2, smile. Okay, very good. Thank you. Thank you very much. So thank you, Friedrich. It's of course, you rightly point to those concerns in the context of the discussion that we will have today. I would like to start off by thanking the Friedrich Naumann Stiftung Foundation for their support with this event. This event, Human Rights Day, of course, it is held annually. We have an event annually for this on this particular day. Of course, it is a holiday in Thailand, but we felt it important to nevertheless have this event on the 9th. It is a very important day, I think, especially in the times that we are living in. It's important to have an annual roundup, especially in the COVID-19 context. So it's important not only to celebrate Human Rights Day, but it's also important to take stock. And we thank again the FNF for partnering with us on this initiative. And I would just say quickly that it is especially important to do so at this particular juncture in whether it's national, regional, or global affairs. We are all aware of the challenges that we face. And of course, it's important that civil society, national human rights institutions be together and collaborate in upholding the standards and the fight, if I may put it that way. So on that note, let me turn it over to Dr. James Gomez. We would like to, you will see before you, have a small, short remembrance for our friend, late friend, Chito Gascon. So let me invite Dr. Gomez to lead this ceremony or this remembrance. James, the floor is yours.
Yeah, thanks, Robin, and once again, thank you to the Friedrich Naumann Foundation for the kind support. We have been long-term partners and happy to collaborate. I want to take a few moments to remember our common friend, Chito Gascon, who until recently was chair of the Philippines Human Rights Commission. He's a personal friend whom I know for over 20 years. And I'm also, one of his, go-betweens. Whenever I meet him, he's always interested to know about the human rights situation in Singapore. And I'm sure, if he was here with us, he would want to know what is COVID-19's impact on Singapore. So I thought in memory of him, I will just, also share a few highlights. I'm currently back in Singapore for the holidays, for Christmas. And coming from Thailand, I've been here now 6 days out of a 7-day home quarantine. If you ask me what was the one thing that I feel while I'm here, is the excessive policing. So at every level, from boarding to the plane, when you arrive at the airport, when you take a taxi home under the stay home notice quarantine, and the calls that they make, to ensure you are at home. The calls are audio and video to ensure, and also the in-between PCR test. 70% of the conversation, it's always about reading your obligations and the penalties that will be imposed on you should you not adhere to the protocol. Now, this is very different, I think, in terms of what you would hear, let's say in Thailand, where that, whole policing, the securitization is not so eminent. So that's, something that, I would say to Chito, because it's something that he would ask me. From the Asia Center perspective, we last had a formal engagement with Chito 4 years ago when we participated in the ASEAN People's Assembly in 2017 in the Philippines, and later on we were invited to the premises at the Commission to have a bilateral meeting to see if we could, collaborate together with the AICHR Center and the Commission. So that's really, our engagement with Chito, and we want to really just take this opportunity to remember his good work as a lawyer, as a civil society organizer, and an all-round human rights activist. At this stage, I would also like to invite Karen Dumpit, who's now currently a commissioner in the Philippines Commission, to maybe also say a few words and his record at the Commission in the last 5 years. Karen, if you could kindly say a few words.
Thank you very much for the tribute. Of course, as you know, we feel the loss. We're still grappling with the grief that has beset us now, and it's Human Rights Week, and we feel the void, actually. But we're praying and hoping that we will survive this. We only have, I believe, 146 days remaining in our term. And we offer this all up to him. And we're just going to forge the direction that he actually showed us where we want to be at the end of the term. And one of the things that we're actually doing right now is tomorrow being Human Rights Day, we're going to relaunch our monitoring of the elections, rights monitoring of the elections. And this is one of the projects that he left us among many, many others. But I hope that, the loss of Chair Chito for us in the Commission is really a loss to the whole international human rights community. And we hope that you will still help us in our advocacy, in our common advocacy, but also requesting for all your prayers and good intentions so that we can forge on and try to finish our term, have a strong finish, and also have something to perhaps, something to hope for, but I'm not really that hopeful actually, that the 6th Commission will be a better commission. But not only that the human rights situation in the Philippines, the course of it will change with the elections that will be coming 4 days after we step down. So maraming salamat sa inyo.
Thank you very much, Karen. I will now pass the time over to Robin, but also say to everyone, both the speakers and also members of the audience, anytime that you are providing an input, please feel free to say a few words of remembrance and interaction that you may have had with Chito. So with that, Robin, back to you.
Thank you, Karen, for those words of remembrance of our dear departed colleague and friend. Again, I reiterate what James has just invited. If there are anyone else who wish to say something, say some kind words regarding Chito, please let me know at this point. In the meanwhile, as we proceed, I will just like to share a poll with you that you can kindly respond to. The poll question is, we have 2 polls. This is the first one. Do you think COVID-19 has significantly impacted human rights? Yes, no, I don't know. So take a moment to respond to the poll in the remaining few seconds. Again, if there is anyone would like to share some thoughts about our friend Chito, let me know also at this point. Okay, so we will discuss the poll result in a second once the results come in. Let's start with proceed to our discussion. And so once again, thank you to all the speakers who are here, who have kindly agreed to be part of this roundtable discussion. So it is a roundtable format, and there are some questions that I will be posing to the panel, and also some questions that have come in from registrants, participants, that I will also be throwing your way as we proceed. So perhaps let's begin in this way. A very basic question is that I would pose to all of you, and we'll do a first round, perhaps starting with Lorraine, if Lorraine doesn't mind. What has been the impact of COVID-19 on human rights in your jurisdiction? So it's a question that, you know, let's have a first round. Maybe we could start with Lorraine, if that's okay.
Certainly, can you hear me okay?
Yes, perfect, thank you.
So, well, can I start by just thanking you for inviting me to be part of this panel? My name's Lorraine Finlay. I've been the Human Rights Commissioner in Australia for 3 weeks now. So I'm very pleased to be here, not only to contribute, but actually to listen and learn from my fellow panelists. So I'm very glad to be able to do that. I wanted to preface all of my remarks tonight by simply saying that in Australia, we are very aware that we have a lot to be thankful for in terms of the pandemic response. You know, I'm very conscious of the fact that in Australia, we've been very fortunate in terms of having a relatively low number of deaths comparatively. So we have a population of about 26 million people in Australia. And as of this morning, our total deaths across the entirety of the pandemic has been 2,072, which is very low. And so obviously with the right to life and right to health being important human rights, it's important not to lose sight of the fact that significant parts of the government response have been very good in terms of protecting life and protecting public health. But that, of course, doesn't tell the whole story. And in Australia, we've certainly had to live with some of the most restrictive response measures in the world. And to give just 2 examples, picking up on measures that Frederic mentioned earlier, we've had border closures since the beginning of the pandemic, both in terms of international border closures and also internal border closures within states and territories. And for example, this has meant significant numbers of Australian citizens have been stranded overseas and unable to return home. At one point, we actually criminalised attempts by Australians to return home from India, which was quite extraordinary. And we're one of the only countries in the world that have restricted citizens from leaving the country without an exemption. So the restrictions have been significant, and this has had an enormous impact on people in terms of families being separated, people being unable to travel, which isn't always for frivolous purposes, but actually is a central part of what makes us human and those family connections that we have. We've also had significant lockdowns. And again, the effects been different across different parts of Australia because we are a federal system. But to give just one example, Melbourne in Victoria has the dubious distinction of being the most locked down city in the world across the pandemic, having spent about 9 months across 6 separate lockdown periods since March 2020. And obviously, those sort of restrictions cause significant damage, again, with families being separated, businesses being closed, children being forced to homeschool rather than being able to attend school. And I think what's been the most concerning from a human rights perspective is not only are there serious impacts on everyone in the community, but it's actually exacerbated existing disadvantage, because we found that the most marginalised and disadvantaged amongst us have often been asked to bear a really disproportionate burden in terms of the impact of the restrictions.
Thank you, Lorraine. So Lorraine Finlay from the Australian Human Rights Commission just spoke about the exacerbation of existing disadvantages in Australia. Let me turn now to Ibu Retty Ratnawati from the National Commission on Human Rights of Indonesia. Please, the floor is yours. What has been the impact of COVID-19 on human rights in Indonesia?
Thank you, Erwin. Yeah, generally speaking, yes, we do have some problem with the almost every factors that influence in the health itself, and that means that will influence also what we call it the determinant factors of the health. Right? So many factors influence that. But in my position is in the National Commission on Violence Against Women, So I would like to say that yes, we have short studies in the beginning last year about how is the response of the or the situation of the women when they deal with the violence against women. So if we just divided the big impact is one is the increase of gender-based violence against women. So the domestic violence increase, the online gender-based violence, and the vulnerability to the exploitation. The second is the aggravating obstacles in delivering services for the victims. So reduction of the service hours, type and the volume, for example, in the safe house, the reduction of the inadequate funds, the extra budget to be allocated to the health measures for the ICT infrastructures. And the third is this is the invisibility of crucial human rights issues. The news coverage, the attention paid by the government, law enforcers, and the public. That is the natural resources based on the conflict, the criminalization of the women human rights defenders, access to the justice. And the fourth is we have the what we call it the challenge for the national human rights institution that contests the human rights and the health sectors, could be the mental health of the public and burnout of the women health. It's the defender, and the strategy to carry out the investigation when the traveling is limited because of the COVID. So this is the situation when we look at our main mandate in Komnas Perempuan. I think this is for this time. Okay, thank you.
Thank you very much, Ibu Retty from Komnas HAM Perempuan. So I take note of your emphasis, obviously, on, in particular, on the victimization of women, the gender aspects of this whole crisis and the responses, and the plight of women human rights defenders at this time. Let me turn now to Karen Dumpit from the Commission on Human Rights of the Philippines. Perhaps you could share your thoughts.
Thank you very much for that question. Let me just frame it to say that, of course, it's not only the impact of the virus, but also the impact of the measures that were implemented by governments to quell the virus. And this is where human rights is actually severely affected by the measures that have been implemented. For instance, of course, we do understand the restrictions in freedom of movement, sharing the issues on lockdown, that the Philippines has indeed one of the longest lockdowns within the country, in the world. And we know that there are pre-existing violations that have persisted. I mean, problems don't just, they're not on lockdown as well. It continues. No? So there is also risks that have been heightened. For instance, our colleague from Indonesia has said about the violence against women, domestic abuse still happens. And it's more intense when you're in a lockdown situation in your homes. Children have been locked down or been marooned in homes. And schooling has been largely online 90% of the time. And this has taken a toll on our children, but it also has exposed our children to online violence and harassment and other violations. The single criterion of age, not being able to go out if you're below 18 and above 60, is something that actually was implemented poorly on the ground, while there were measures that were said to be an exception, like let's say if you're going out for essential services. This is something that was not implemented, especially at the beginning of the lockdowns, and it actually caused some older persons to be accosted, to be detained, and while children, of course, remain locked down. No? But it's not only that; it's also the transport services. We have the transport services not being allowed to ply the streets, so our iconic jeepney and the drivers have not been able to eke out a living, and they were actually relying on relief goods that were distributed by local government. Aside from that, of course, the pressure in the health system is really there because of the virus, because of the incidences, the cases that have been, it was on the uptick, especially in August, September, when Delta variant came in the country. And as you know, Chair Chito actually succumbed to the Delta variant. And just to say also, freedom of expression, when you rant on Facebook, you find yourself, there have been cases of cyber libel against people who have criticized government, particularly local government. We've had that. Those violating health protocols have been detained in overcrowded detention facilities. So it has been it turns out to be a counterproductive measure. Just on a last point, discrimination is on the rise, of course, and the pandemic actually gave rise to a new group of discriminated sector, and these are medical frontliners who found themselves ejected from their places that they rent because the community actually feared catching the virus from them. So I'm going to stop there. Thank you.
Thank you, Karen, very much. And in addition to, you have also mentioned violence against women. You have mentioned the problems of education, schooling, the elderly, and challenges of freedom of expression. Before let me ask Eric Paulsen, a representative from Malaysia of the ASEAN Intergovernmental Commission on Human Rights, to share his thoughts about what you are experiencing in Malaysia. And just let me mention, just after Eric, we will also show you the results of the poll. Okay, so please, Eric.
Thank you, Robin, James, for the very kind invitation to participate in this webinar. What I have to say might not be coherent with the topic, in the sense that AICHR works a bit differently from National Human Rights Commission. So AICHR is an intergovernmental commission on human rights. It is a creature of ASEAN. And the jurisdiction, as per your question, we are limited by our terms of reference. So that is probably for a different discussion, but I think the terms of reference here would limit in terms of what I can say or what AICHR can do. So here I would like to turn the question, answer in a slightly different way. So rather than spotlight the impact of human rights violation towards various populations, which I think some of the commissioners have highlighted very well in Australia, in Indonesia, and in the Philippines. I would like to focus on the work of AICHR that has been done over the last couple of years, and especially on its work that's related to that has to do in some aspects of COVID-19. Like everyone else, AICHR too has to adapt to the changes brought forth by COVID-19. As you know, AICHR, since its establishment in 2009, it has done a tremendous amount of work in the promotional aspect of human rights. but less so in terms of the protection work. And that has continued during the pandemic. So we carried on our meetings and human rights workshops and activities online, including we held a regional forum on the right to health, which was led by AICHR Indonesia. The forum focused on the universal health coverage for groups at risk or those most affected by COVID-19, particularly for migrant workers in ASEAN. Further, AICHR also contributed to the discussions of the ASEAN Comprehensive Recovery Framework, or ACRF, which ASEAN has developed as its exit strategy from the COVID-19 pandemic. The ACRF, as you know, was endorsed at the 37th ASEAN Summit in November 2020. And some of these broad strategies include to enhance the health systems and to strengthen human security. Lastly, I'd like to add that AICHR also, during the pandemic, we managed to draft and adopt its 5-year work plan, which was approved by the ASEAN Foreign Ministers meeting in September 2020. The 5-year work plan is the most ambitious yet. To those who are interested in the work of the AICHR, it can be found on the AICHR website. And if it's completed, it can be considered a significant achievement for AICHR, all the more so under the difficult circumstances of COVID-19. So that's my answer to your question. Thank you.
Thank you, Eric. And we will come back to some of these points. At this point, allow me to show the results of the poll. That, you know, the question that you answered was, do you think that COVID-19 has negatively impacted human rights? And that's 89, nearly 90% of you, well, 89% of you say yes, 4% of you say no, and is that 8%? 8% of you say I don't know. So broadly, the discussion so far conforms with the views of the participants listening, and thank you to the participants for also being here. So let's pursue this discussion maybe in a slightly more focused way in terms of how each one of your commissions, you know, the national commissions in particular. Eric has already spoken about the work of AICHR. Maybe those in the national commissions could state a little bit more about how their own national commissions have responded specifically. Let me start off maybe with Karen. Perhaps you could take the floor, and then others could chime in. Sorry, yeah, Karen.
Yes.
Yeah.
Thank you very much for that question again. No? Of course, how did we respond? First and foremost, when there was when the government first announced what they wanted to do, of course we supported government because this is a common concern and everybody is affected by this. So what we did was we issued an advisory to government to ensure that there is a human rights-based approach to containing the virus, of course. And of course, we said that, you know, any restrictions to rights should be based on a proper policy or issuance, and they should have a legitimate aim and objective, which we all know is really to quell the virus, but also the public must know how to act in this kind of situation, which is something that is so new to us. We didn't expect that the situation will be a protracted one. But aside from that, we continued monitoring the rights, as I've shared with you. Some of the violations that we have seen, of course, is older people being turned away in transportation because of their age, because of the wrong implementation of the advisories from government. We do have the domestic abuse cases where we find that even shelters were locked down. So we had to call local government to say, you can't lock down shelters because if women need a refuge, you have to respond to it properly. But even in complaints desk at the village level, they would say if a woman comes to them and reports on domestic violence cases, they would often hear the advice that, oh, can you just go back after the lockdown or after the pandemic? So we've sorted this out with government, and particularly the Department of Interior and Local Government, to issue a clarificatory memorandum. And I believe we did issue that jointly with government. Now, having said that, we also advised a government to actually, try to put health at the front and center of the response. And the strong arm governance is something that we don't like to see as an emphasis, because it is counterproductive when you find violators being locked up in overcrowded cells. And that's not the point of why we're trying to do all these measures. No? With that, what we have done was we opened a reporting portal, an e-reporting portal for gender-based violence. That's one. We bridged services. So people who needed transport, particularly women in distress, were brought to the centers that were open. We also opened our doors for temporary, very temporary shelter, just to be able to wait for the shelters to open. And then also we had referral pathways in place with civil society organizations so that they can respond when there are gaps in services with government. I'm going to stop there.
One quick point. You mentioned opening up, you mentioned the shelters. This was implemented on a national scale?
Yes, but of course, as the places that we've been able to monitor are really largely in the National Capital Region.
Right.
But we do have similar occurrences in other regional districts in the country.
Very well. Thank you for that, Karen. So you mentioned the shelters, reporting on gender, the e-reporting portal on gender-based violence. Very interesting. One thing you mentioned, Karen, is, it is intriguing, which is how should the public act? And so let me turn maybe to Lorraine on that question, that point, while you address the larger question of how the Australian Commission has responded.
Well, I think my answer to that actually ties both of those points together, because one of the things the Commission, and we have state and territory-based human rights commissions and equal opportunity commissions as well. So one of the things we've all been very conscious of is the balance between ensuring that we support the public health messaging, because obviously saving lives and protecting public health is the #1 priority during a pandemic, but while at the same time highlighting the human rights concerns that have arisen as part of the pandemic response. And really, the Australian Human Rights Commission and our counterparts at the state and territory level have focused on 4 things throughout the pandemic. The first has really been engaging with government and the bureaucracy to ensure that decision makers who were making decisions that had an enormous impact on people's lives during the pandemic had human rights concerns at the heart of what they were doing. The second thing has been providing information to the public. We found that during the pandemic, there was so much changing information and misinformation that ensuring the public had a place they could go to receive trustworthy information about pandemic restrictions and human rights concerns was very important. And you can see, for example, from the Australian Human Rights Commission website, there was a real thirst for knowledge out in the broader community, because the access to our website was increased significantly during the pandemic. The third thing is our complaints mechanism. We have a complaints mechanism within our commission, and the number of complaints we've received during the pandemic have increased significantly. And the final thing is actually, I think, the most important, and that is the public advocacy role that the Commission plays. And I think what's been really critical during the pandemic is to make sure that the broader public is aware that even in an emergency, and particularly in an emergency, human rights continue to matter. So having people who are publicly speaking about the importance of protecting health, but the importance of making sure that we also don't forget about other important human rights, and that we make sure restrictions are limited and proportionate and justified. That type of public advocacy is, I think, critically important, particularly in times of emergency.
Thank you, Lorraine. In fact, two very interesting points that I would like to come back to, maybe in the course of the discussion. One is trustworthy information to the public, which is, I think, a critical issue, and the complaints mechanism. And that's perhaps the next round of question that we may come to. Let me ask now Ibu Retty Ratnawati from the Komnas HAM Perempuan for her thoughts on this question. How has your institution, Komnas HAM Perempuan, responded specifically?
Yeah, specifically, we have to follow the rules. Do not against the rule. And even this is very painful in some process for the institution. So we have to close down, and then some staff have the positive of COVID, and we have to reorganize, and then the government give the the special budget on how to deal with these to prevent. So we have to do some antigen swab or close the office when the somebody got the positive COVID for several days. And so it seems that we have to work from home. Yeah, a little bit confusing actually for the staff, if you ask about the staff. But the most important thing is also that the people, I mean the victims, that problem, because the women defender or the women crisis center, they are also close, and they need some, what we call it, if you come to me, that means that you are free from the COVID or things like that, and then they complain directly to our office. Even actually we do not have the service directly to the victims, but we open with the, what we call it, the internet. They can email us, they can using the medsos. So, and the letter and phone, of course, and then that's increased most. Usually we only have about, say, 1,000, then become 4,000, something like that. So this is the situation. There's a little bit chaos actually, if I have to tell the truth, and that's not good at all. And when we learn from outside, for example, the woman who'd like to have the have to deliver their baby, the first of all is when they go to the hospital, do you have the negative COVID certificate or something like that? And then situation become not good at all. So in some places, yeah, Indonesia is very wide and very large. In some places, they have to reduce their office hour. If they reduce the office hour in the pollution station in a small area, so that is problem when there is some GBV have to report. So situation is not quite good, but we really appreciate the service, Women Crisis Center services, that they try to rearrange the how to operate themselves to service the client. So that's something has happened here. Thank you.
Thank you, Ibu Retty. I think you have touched upon something very important, which is the challenges to your own operations and the operations of the NHRIs and Komnas Perempuan also. And it speaks to the need for the going forward, effective collaboration between different institutions at multiple levels. Whether it's what, in the terms that how Lorraine put it, whether it's you said the federal or the territory level, is that correct? The state or the territory level and so on. Eric, if you wish to come in and comment in the case of Malaysia, please do so.
Sure.
Any thoughts?
Sure. I mean, I would stick to my work in AICHR. So in responding to the pandemic, on the 1st of May, 2020, AICHR released a press statement. It's actually the first ever on a thematic issue on COVID-19. It reaffirms Article 29 of the ASEAN Human Rights Declaration that the right to health is guaranteed to all people, and that the measures taken to protect public health must include women, children, the elderly, people with disabilities, migrant workers, and other vulnerable and marginalized groups. The COVID-19 statement is also notable because it recognizes, in line with international standards, that although human rights can be restricted by states in the pursuit of a legitimate aim, this is subject to the principles of necessity and proportionality. It might seem a bit curious for me to highlight a statement that has been issued by AICHR. But as I said earlier, this is the first ever thematic statement, even though AICHR has been existent for close to 12 years, because it's not always easy to get consensus from all 10 state parties. Previously, for the last couple of years, I tried to get a statement going on the haze. As you know, haze is a recurring problem that affects the entire region, and also on the Myanmar coup itself, but we failed to obtain consensus. But I'm happy to add that back in April 2021, because the issue in Myanmar, I know I'm digressing a bit, but I'd like to report that because of the dire situation in Myanmar, because of the changes in terms of the mood within ASEAN, for the first time, we also discussed the human rights situation in Myanmar. So we had a very robust discussion in AICHR, where several countries raised concerns on the situation in Myanmar. Thank you.
AICHR and a broader regional perspective. I wish to come back to the point that I think all of you are making, but specifically, I think Lorraine mentioned this specifically, the complaints mechanisms. And perhaps I will address this to the national human rights commissioners here, and Komnas HAM Perempuan, to address this specifically. The question that I have, and that has come up, is have citizens reached out to your institutions through your complaints procedures to express their concerns on different issues? And I'm wondering to what extent they have done so, how you have responded. Now, as you think about that, especially Lorraine, Ibu Retty, Karen, we would like to play a quick short video, 3-4 minutes, of our colleague, the chairperson of the National Human Rights Commission of Thailand, who has kindly contributed her thoughts on this via video. And so this is Commissioner Chairperson Porn Prapai Ganjanarin. And so we will play the video now and listen to her intervention.
In 2021, the AICHR received several complaints related to the COVID-19 pandemic. These complaints involve the inability and thus inequality in online school learning, the inability and inadequacy of medical treatment for prison inmates, the mismanagement of COVID-19 tests, resulting in the delayed and difficult access to the service, the delay in public health services, and the government's failure to remedy affected people. In a number of complaint cases, the NHRCT has communicated and coordinated with relevant agencies to quickly solve problems such as the assistance of COVID-19 infected pregnant women in receiving timely medical care. Third, recommendations to the government on measures or guidelines for the promotion and protection of human rights in the context of the COVID-19 pandemic. In March 2021, the NHRCT issued the first recommendation to the Prime Minister in his capacity of Director of the Center for COVID-19 Situation Administration, or CCSA. The recommendation encouraged the authorities to address the impact of human rights in the situation of COVID-19 as follows. 1. To provide people with correct knowledge and understanding so that COVID-19 patients are not stigmatized in society. Second, to ensure respect for the right to privacy. Third, to ensure universal and fair access to vaccine. Fourth, to conduct a survey of those who are neglected and unable to access aid schemes. And finally, to care for poor students who are disadvantaged in education and other aspects. Later, the CCSA positively responded to the NHRCT's recommendations, and the Prime Minister has directed relevant agencies to implement measures in line with the recommendation. The CCSA also instructed local authorities to survey those who have been unable to access the government's remedial measures in order to provide additional assistance. During the third wave of COVID-19 pandemic, the NHRCT issued the second recommendation to the Prime Minister to redress the situation as follows. First, to speed up the provision of vaccine with appropriate quality for vulnerable groups. Second, to establish an ad hoc operation centers as a one-stop service at the local or community level to provide comprehensive and timely care. Third, to search for vulnerable people who fail from vaccine registration. Fourth, to undertake proactive screening of infected people. Then to effectively improve patient referral system. Fifth, to thoroughly provide food and medicine to persons affected by COVID-19 and requiring quarantine or isolation. And lastly, to provide vulnerable groups with necessary COVID-19 protective devices, including essential consumer items. Considering human rights implications of the COVID-19 pandemic, it can be concluded that a strong social protection system covering with universal coverage, particular workers in informal sector and vulnerable groups is essential when there is a crisis threatening people's livelihood. I sincerely believe that the exchange of information and the NHRCT's experience today will be useful for participants in your respective organization to safeguard human rights of all people in the situation of no end in sight to the COVID-19 crisis. Thank you.
Who is the chairperson of the NHRCT of Thailand, with whom we have good collaboration here in Bangkok and throughout Thailand. So we continue our engagement on the NHRI, the role of NHRIs in not only in Thailand, but across the region, as this webinar also testifies to. So you heard there the chairperson talking about complaints or information received from the public. I wonder if I could just get a quick round from each of you, from the commissions. What's your experience? How many complaints, if you have figures? What's the response time? These kind of details. You heard there that the chairperson also issued recommendations. I know you have all done that. But in light of the complaints that you've received, what's been some of the actions that you could possibly take? Perhaps I will start with maybe Karen, you could start on this.
Thank you so much. Aside from what we heard earlier, I'm not gonna dwell on that anymore. But one of the higher complaints that we've had, in fact, this was number one, is really the complaints on receiving the relief goods. It's not enough. So we also had to make representations on that. The quality of relief items are also complained about. Aside from that, this is something that's actually very close to NHRI work, which is really visiting places of detention. And this is something that, that we also took a look at, because families of detained persons have complained that, of course, visitation was totally suspended in a lockdown. But then there were detention places, particularly in what we call the National Penitentiary, one of the national penitentiaries. There were a lot of reported COVID deaths. And then a piling up of so many bodies that even the inmates themselves were calling out and asking us to visit. But of course, because of the very strict protocol, it took some time before we were able to investigate the matter. And of course, there were some allegations of body swapping, meaning that this could be an avenue for high-profile and highly influential detainees to escape. So these are just the conspiracy theories that we hear, of course. But we need to take each and every allegation seriously, so that we are we wanted to have conversations and have the visits undertaken as soon as we received them, but that proved to be really quite difficult. Of course, there were still continuing killings that have been happening, but because of the lockdown, it was also very difficult for us to find witnesses. It was difficult before, it's made difficult now. And then there were also complaints about arrests and the treatment of persons in custody. Because of the violations of health protocols, for instance. But you see some local enforcers, local government enforcers who would punish children, let's say, for going out and locking them in dog cages. That was a very well publicized incident on the media. So all these things, I mean, you know, just to say that these violations have been occurring in the past, but it was further exacerbated, and even the response to it is really something that was made difficult because of the measures to quell the virus.
You join Ibu Retty in emphasizing the challenge of investigation operation, you know, in these difficult times, while noting these specific issues of detention places, providing relief, and the one that you just mentioned is, you know, it sounded like kidnapping. In some ways, and putting people in cages, if I may put it that way. Yeah, that's a very difficult one. Let me turn to Ibu Retty. What are your thoughts? How have citizens reached out to you specifically? Perhaps how many complaints? You've talked about the operational challenges, but perhaps give us an idea.
Yeah, actually the complaint related to the how the management COVID-19 is not direct to our office though. But as I told you, there is a lot of complaint in the gender-based violence against women. That was the increase, and therefore the situation is more in because our mandate is not directed to serve the victims, but we have to have our what do they call it? Our service that is directly to, like the Women Crisis Center, they directly goes to there, but in our mandate is we do not do that way, but we have to do some paperwork or something that really they need if they ask for in a litigation, for example, like that. So we have the complaint from the women human rights defenders a lot, that what we should do with this, and they burn out more than before. So we have to reorganize to do this mental health problem by sharing what is actually the problem. But that is what we have the new challenge in the NI and HRI, and so the investigation is a little bit difficult actually. If we have to organize that with the our colleagues who do the service. So that is the situation actually.
Thank you, Ibu Retty. I understand the challenges that you face, and especially I go back to what I was saying, the challenge of coordinating with other mechanisms. I know that Indonesia has several commissions, and this is one of the, I believe, in my understanding, one of the challenges that you have, which is effective coordination. What do you do with the complaints that come from the women human rights defenders, and how are they passed on, to whom they are passed on, and what is the follow-up, and so on. So indeed, a very difficult situation. Ibu Retty, you mentioned the challenge of mental health. And so a question just came in, which I will maybe ask Lorraine to comment on, while commenting, Lorraine, on the complaints issue, the complaints mechanisms. I mean, I wonder how many of those complaints addressed or related to the mental health. There was a question about students' mental health in this situation. Lorraine, over to you.
Well, I might start with the broader question about complaints and move to the specific mental health. And in relation to the complaints, there are really two things that strike me about the Australian Human Rights Commission experience. The first is the formal complaints mechanism, and then I might just say something quickly about sort of informal complaints, if I can put it that way. In terms of the formal complaints mechanism, we have a quite prescriptive mechanism. So it's an investigation and conciliation mechanism. And we've certainly seen a significant increase in the number of complaints over the term of the pandemic, which has led to a resultant increase in the amount of time it takes potentially to resolve complaints. But importantly, it's a conciliation process. So it is quite specific. The other thing that I find interesting about that is, as the Human Rights Commissioner, I actually have no formal role in the complaints process. That's dealt with by our president. But what I have had in the 3 weeks since I've been in the job is a surprising, well, I found it surprising simply because I wasn't really expecting it, a significant number of people reaching out to me informally not to make a complaint, but simply to express their concerns and to explain their personal situation and how the pandemic's affected them. And it strikes me that this is a role of NHRIs that perhaps isn't as well developed or as formalised, but I think the fact that they provide an opportunity for people to raise concerns, even if it's in an informal way, and to ensure that those human rights concerns do have an outlet, actually strikes me as a very significant role. In terms of the mental health aspect, I think it's undeniable that there have been important impacts on mental health as a result of the pandemic. And if I could just highlight one in terms of Australia, the lockdowns obviously have had an enormous impact on mental health, particularly in relation to children and young people. And that can be seen through the reports from all of our various support services who've reported enormous increases in the number of referrals and the support that's been needed from them, but also in relation to our quarantining requirements. So we had, or still have in some respects, our border closures and strict quarantine requirements in terms of people who returned to Australia and were then required to spend significant periods of time in hotel quarantine. And again, the mental health aspects of that are quite concerning in terms of people who are already in very vulnerable situations being placed in those quarantine requirements. The really difficult thing during the pandemic, which flows through everything, is understanding the importance of these types of requirements in terms of public health, but then recognising they have a real impact on people and have unintended consequences in terms of things like mental health. And I think those outcomes are going to, unfortunately, be very long-term and are going to need considerable, we're going to need to reflect really on the way that the pandemic response measures have impacted on things like mental health, because I think it's a lot more substantial than we currently realise.
Thank you, Lorraine. That was, what I retained from your response there is, I think, something very important, which is the very fact of being able to contact someone to express your grievance is already starting the redress. The process of redressing, a difficult situation that people may face. So thank you for that. Before we move on to maybe a couple closing questions, let me just throw you the second poll that we have for today. It will come up just very shortly. So this is the second poll that we have for today. Do you think, in light of the discussion, we thought we would throw this question here today, do you think the Human Rights Commission in your country or elsewhere has helped improve the human rights situation during the pandemic? Yes, no, I don't know. So please participate, and we will come back to the results of the poll in a second. And I encourage participants to also please share your questions in the chat box. There are a few that have already come in to us previously and during this, this webinar today. Let me perhaps turn to one that we have received. I come back to your the point that was made by a couple of you, speakers previously, and that is, I recall specifically Lorraine, the impact on the public, and also I think you, Karen. So I'm very curious about the management of an emergency, a public emergency, and there are, of course, rights can be limited during, appropriately, legally, justifiably, and so on. But how do you explain that? How have you been able to explain that to a segment of the population that is resistant to the temporary lifting of their rights for such a pandemic? I mean, I'm specifically referring to, for example, and broadly speaking, the anti-vaxxers. Would anyone like to start off on that? How do you convince the anti-vaxxers? What are the rights of anti-vaxxers? Let's put it that way. Maybe I will ask, in the case of women, human rights defenders and women in Indonesia, Ibu Retty. Have you had to address this issue?
Yes, this is not easy issues actually, especially when we just started having the vaccines that time, and they also got a lot of hoax. So this is, I think that's not good. And then the hoax related to their reproductive organ, for example, as a woman, do not get the vaccine because that will influence your menstruation period or your baby or your, so that is a lot of things like that happen in our country, and then the hoax will influence that situation. And some places, in a, what we call it, in a place that is they anti-vaccine because the information is not quite right, and in very few people also they do not like to be vaccinated because this is the time to get the vaccination is related with their busiest hours in the house to do the domestic domestic work. In some cases, they try to look for another time to do so, but in a few situation, I heard that the what we call it, the office in the village will show the flyer saying that if you do not vaccinated yet, then you cannot arrange or ask for help to do your administration work, something like that. And so this is what happened in my country lately. And also the people with the disability, of course, have also some problem, but lately then become they have the problem because people do not know if there is some disability in that house, for example, something like that. But lately that has become better. That is in this situation, but not in the previous when we got some vaccine applied. Thank you.
Thank you, Ibu Retty. I think you have also in the process, I think both you and Lorraine have been addressing a question that just came through. If complaining is a kind of human rights, what sort of human right is if someone is not yet vaccinated? So I think you have been speaking to that a little bit, Ibu Retty. Maybe I could turn to that question. Karen, would you have any thoughts on that and the larger question of the anti-vaxxers?
Okay, let me just address the previous question, which is really anti-vaxxers' rights. But let me just perhaps unpack what we mean by anti-vaxxer, because if you take a look at if you take a look at it from the perspective of vaccine hesitancy, or the capacity to be able to receive the vaccine, or the accessibility, I think that we can better understand why people refuse, that's one, or why people cannot get the vaccine because of medical conditions, perhaps. And this is something that is really fueled by disinformation. So I think this is one of the human rights that have been impacted by the pandemic, because there's a lot of disinformation out there. We need to correct it. But at the end of the day, when we're talking about individual rights, we need to empower, we need to enable individuals to be able to make the informed choice of accepting the vaccine or not. In the Philippines, it has not yet been made mandatory, but there are certain establishments that have required already vaccine certificates. And if you don't have any vaccine certificate, then you're turned away because they're private establishments. Or if you can show an RT-PCR test, perhaps then you will be allowed in. But if you haven't been vaccinated in some establishments, what they would do is they will sit you outside of the establishment. And those that have the certificate can go in and dine in, for instance, in restaurants. But the important message there is actually there is really a balance, no? Because collectively we want to reach what you call herd immunity, and we cannot do that if there is a lot of disinformation being used so that people are now afraid to take the vaccine. In fact, in the Philippines, among older persons, vaccine hesitancy is very high. They have not been wanting to take the vaccines because of this information that has been spread. So similarly, if we have advised government that sure, we can always come up with all these rules, but then we need to be clear on what these rules mean. Because if implementation on the ground is patchy and it's not standard, then there's something wrong with the policy in the first place. So, and similarly, it's the same for vaccine equity as well. Because even accessibility to the vaccine is also something that is hampering the response and the management of this pandemic. If we want to quell it, we need to reach herd immunity. We need to address this information at the community, but also at the individual level, because there are accessibility issues that is really something that should be addressed by government. I hope I've been able to answer the second question when I elaborated. Thank you.
Thank you, Karen. Yes, you have. And in fact, I just wanted to highlight what both you and Ibu Retty have mentioned, which is the problem of disinformation. The so-called anti-vaxxer problem issue is very complex. There are people who will, of course, always refuse to take any kind of vaccine out of whatever principle they have. But then the problem of disinformation is a real problem. And you also raised the issue which relates to a question that just came in regarding policies, laws that discriminate against particular communities. So I wonder, maybe I don't know, Eric, possibly could you address that particular point of policies that have been adopted or laws that have been discriminated against particular communities in terms of access to the vaccine or and so on.
Sure. Thanks, James. But before I move on to that, I think I'd like to raise a couple of comments. I mean, at least in Malaysia, I mean, the vaccination rate, I think we are kind of lucky that for now, the rates are quite high. I think it's almost close to 80 to 90% of all population have been vaccinated. But nonetheless, in the early days of the pandemic, the issue of misinformation and disinformation, it was quite serious. And I think I'd like to flag here that some of the social media platforms also bears a responsibility, especially Facebook. It was quite slow in terms of tackling disinformation, deliberately attempt to frankly quite irresponsible information regarding vaccines and the pandemic. But coming back on this issue about whether I have a right not to be vaccinated. I would like to disagree with that because you're not living as a hermit in a large estate. You are living in a community. If you are, like I said, if you're if you live in a very large estate, and I would like to draw the analogy of somebody who's driving a car, right? If you drive by yourself without any safety equipment, you have no license. If you want to harm yourself, you want to drive over a cliff, it's really up to you, right? But once you start driving to the public road, you are harming other road users. And I would say that's the case with anti-vaxxers. Of course, if you have a legitimate reason not to be vaccinated, for example, you have health concerns, I think that is fine. And of course, they shouldn't be treated harshly or disproportionately. But if you claim that, look, I don't want to be vaccinated because they're going to put microchip in it and they're going to track me to whatever that I'm doing, then I'm sorry, you really do not have a right to harm other people. So I think it is incumbent upon not just the government and the agencies, but also to a lot of human rights defenders to explain to these people that you really do not have a right to infect others, by your lack of care, regarding vaccines and the pandemic. Thank you.
Thank you, Eric. Lorraine, a quick thought from you, if you would like.
Just a very quick thought, and it's to touch on something that Eric said. I think he's really hit at the heart of the vaccine mandate issue, which is how do we balance out the rights of the individual when it comes to choice in terms of medical procedures and what they do with their body versus the broader rights of the community in relation to public health. And it really comes down to the fact that human rights aren't just about you as an individual, but it's also about how your choices affect other people in your community. And so there does need to be that balancing. And in terms of the government response and private companies as well, when they're thinking about vaccine mandates, we really need to go back to first principles, which is that governments can restrict human rights in times of emergency and to protect public health, but the restrictions always need to be justified, they need to be necessary, and particularly in this case, they need to be proportionate, which is why I would have some concerns about broad-based vaccine mandates that don't have appropriate protections for example, people who aren't medically able to take vaccinations. But there's a different calculation when you talk about targeting mandates to risk and when you talk about sort of high risk situations where the proportionality considerations are different. So vaccine mandates as a whole raise really important human rights issues. But going back to the point that Karen made, it's hard to have that serious discussion when there's so much misinformation out there. And I think a really important role that NHRIs can play is making sure that we educate, and we do that with patience, because ultimately it's better to bring people along with you when it comes to questions like vaccination, rather than to try and use coercion to force that position.
Thank you, Lorraine. Thank you very much, and to all of you. This discussion could go on for a very long time. Let me just there are many questions coming from you, and unfortunately, we will not be able to address all of them. Questions from the audience and the students regarding what the international community can do to hold global leaders accountable at this time. What is the balance between the cost of human lives and the cost to the economy, for example? How to preserve quality education. One question that did come in was regarding how can students contribute to mitigating or creating more positive human rights. Excuse me, I'm not formulating it very well. How to minimize the impact of COVID-19 on human rights? How can we, students, help? And maybe I will just say a quick word on that, answer it in the following way. In the interest of time, I relate it to the discussion about disinformation. Students can certainly participate by looking at the National Human Rights Commission's authoritative bodies who are not prone to spreading disinformation and to spreading proper fact-based information. I think students can play a very important role there. Before we conclude, let me just at least show you the results of the second poll. Yes, can we see that? Okay, so the question was, do you think the human rights commissions in your country or elsewhere has helped improve the human rights situation during the pandemic? 25% of you, if I'm correct, say yes. 41% say no, and the rest say, I don't know. So how shall we conclude? We have our work cut out for us. But as we have heard today, I would say we certainly have heard, and you have eloquently explained the vital role that National Human Rights Commissions do play. And I encourage everyone to consult the websites and the information of the NHRIs present here and in their own countries. Now, before we conclude proceedings, I would like you to ask the participants to take our survey. You know, you see it before you, scan the QR code. We will also send you a link to the survey. We value your input and your recommendations, your feedback for future such webinars. So please do take the time in the remaining minutes to complete it. Secondly, I do wish to reiterate our 3 reports on internet freedoms in Myanmar, Timor-Leste, and Cambodia. I think they are timely reports in the context in which we live in. So please have a look. You will also receive information about that, or you already have. And moving forward, please do remember our Business and Human Rights in Southeast Asia launch event, which will take place next week on 15th of December. There are 2 panels in the morning and in the afternoon, 10 to 12 and 2 to 4. So please do have a look at that. You will receive information about that as well. There is the event. And lastly, we have, please don't forget our conference next year, our call for partnerships for our conference, 7th International Conference on Freedom of Expression in Asia. So with that said, you know, unfortunately, all good things must come to an end. And I do thank very much our speakers today for their interventions, for this very interesting discussion. We must follow it up sometime down the road, maybe next year, and to see how you are all doing and progressing. And so with that said, I turn the floor over to Dr. James Gomez for some closing remarks.
Thank you very much, Robin. My role here really is to give a vote of thanks to the speakers, Commissioner Karen, Lorraine, Eric, Retty, and Prompai from Thailand. Thank you very much for your insightful comments and for being with us. A special shout out to our partner, the Friedrich Naumann Foundation, and its head of Thailand and Myanmar, Frederic Spohr. Thank you always for being here with us and supporting us. From the discussion today, the one thing I can take away really, and which was also one of the key findings of our book on National Human Rights Commissions in Southeast Asia, is I think the members of the public don't quite really understand or know for sure the breadth of the work of the Human Rights Commission and good work they do, and the impact. And I think it's important that the work of the commissions, both at the national and regional level, are articulated. I think we are beset with some natural biases in the region that you know, these institutions don't work. I mean, they have their challenges, but I think if we are able to articulate more clearly some of the wins that we have had in moving the rights agenda, even a little bit forward. I think that must be celebrated, and I think that's, for me, is the key takeaway. There's a lot of work there we can do, and we look forward to working with all the commissioners and the commissioners going forward. We wish you well, and thanks for being with us. And we will reach out to you next year to see if we could, find ways in which we could collaborate, bilaterally or jointly. So with that, once again, thank you very much to all the commissioners who are our speakers today, and to our partner, Friedrich Naumann Foundation, and the head of the Thailand and Myanmar office, Frederic Spohr. Back to you, Robin.
Very well. Thank you, James. The last word is thank you. Thank you very much, and see you all very soon.
Thank you.
Thank you. Bye.
Bye-bye.
Thank you. Bye-bye.